All right, I am here in Wilmington, Delaware. I am on the rooftop of the Quoin Hotel. Let me give you a look at the view. So that's what we're looking at here. We haven't spent a lot of time here in Delaware, so we're going to go explore it here this morning, but you're not here for that. You're here to learn how Medicare works in Delaware. Let's talk about that. Let's start with the Medicare Supplement Plan side of the conversation first. When we talk about supplement plans, we want to know about costs. Now, nationally, if a 65-year-old is going to be looking for a Medicare Supplement Plan, the average is $150 per person per month. In Delaware, it is $150 per person per month, so right on the national averages there. If you're looking for a Plan N, national average is $120 per person per month for a 65-year-old. Here in Delaware, it's $115, so right there at the averages from a supplement plan perspective. With those costs, there are opportunities to get even lower costs through discounts. Insurance companies are willing to offer discounts for certain reasons, and this is why I always recommend using an agent, because an agent will be able to find you these discounts in addition to which insurance companies are experiencing the more stable rate increases over time. So the discounts that I'll talk about here are, one would be a household discount. That's if, let's say, me and my spouse, so somebody living in my house, are on supplement plans and we're with the same insurance company for those supplement plans, they're willing to give a household discount. Another discount would be a wearable discount. If you're willing to wear a smartwatch, a Fitbit, a Garmin, and sync that with the insurance company, then they can see that you're active and exercising. They're willing to give you a discount for that. And then the last discount that I'll talk about here is an annual discount. So if you're willing to pay your premiums for the whole year up front rather than month to month, there are some companies that will give you a discount for that. And some of these companies will stack these discounts. So you can get all three of them with certain ones. And again, this is, use an agent to help you with this. It will never cost you anything, even if it's not us. Just use an agent that can find you these opportunities. You are looking at attained age plans here. That means that your supplement plans are based on the age that you have attained. So every insurance company, when it comes to these supplement plans, will have some sort of an annual increase to account for rising healthcare costs and inflation. That's with attained age plans, rated. But with attained age plans that apply here, you're also getting what we sarcastically refer to as a happy birthday increase. This is because on your birthday, you've attained a new age, and the insurance companies can give you another bump on those rates. So you could see potentially 2 rate increases with attained age plans. With the supplement plan penetration rate, that refers to how many people are picking supplement plans in general, all letters, versus other options like Advantage plans, FEHB, or other plans. And nationally, the average is 21%. Here in Delaware, it is 27%. That is the 13th highest state when it comes to supplement plan penetration rate. You don't have any unique rules here when it comes to switching supplement plans. You're going through the same national rules. If you're wanting to switch, you're going through medical underwriting. So you're going to answer medical questions. If your health is good, then you can make that switch easily. If your health is poor, you will either be charged higher rates or denied completely. This applies if you want to go from a supplement plan G from one company over to a supplement plan G with another company, or let's say you are on a supplement plan G and you want to go down to a plan N. Either way, you're still going through medical underwriting to make these switches. I'll wrap up the supplement plan section talking about those who are pre-65. So you're qualifying for Medicare because you're disabled, you have end-stage renal disease, ESRD, kidney failure, or you're diagnosed with ALS or Lou Gehrig's disease. In that instance, in most states, you really don't have a big selection, if any, for a supplement plan. And here in Delaware, you do have access to all of the plan letters, but they are considerably more expensive. Pre-65, you're looking at either original Medicare only. You can go with one of these expensive supplement plans, more so than a 65-year-old, or you can coordinate with your employer. If you are employed, or your spouse, then you're coordinating with Medicare and your employer coverage. Once you reach 65, you do have a window there where you are able to jump on any of the plan letters, and then you will start paying the same amount as any other 65-year-old. So if you are pre-65, just know that once you hit 65, you're going to want to look into getting a supplement plan at the same cost everybody else is experiencing, if a supplement plan is what you want. Now let's move over to the Advantage plan side of the conversation. The big number that we look at from an Advantage plan perspective is that maximum out-of-pocket. What is your maximum risk in a given year, where if everything goes wrong, once you hit this, the insurance company will take care of 100% of the approved charges above this number. So nationally, the maximum out-of-pocket average is $5,000 for Advantage plans. Here in Delaware, it's around $6,000. So you're a little bit more than the national average. Again, these are averages. You will find plans that are higher. You will find plans that are lower. The Advantage plan penetration rate across the country is 50%. Here in Delaware, it is 30%, making you the 5th lowest state when it comes to Advantage plans. Now, this isn't me telling you you should or shouldn't get an Advantage plan or a supplement plan. These are just the numbers that we're seeing here in Delaware. You follow the same standard rules that apply nationally. What this means is that you're going to want to look at 2 trial rights. The first is when you take Medicare at your 65th birthday, and you take an Advantage plan. It only works if you're taking Medicare at your 65th birthday and you take an Advantage plan. Then you have a 12-month window to try it out, and if you don't like it, within those 12 months you can switch back to original Medicare and a supplement plan with no medical underwriting. You don't have to answer those questions. You won't be denied. The second trial right applies if you take Medicare at any age. It doesn't have to be at your 65th birthday, but you take a supplement plan first. So if you've taken that supplement plan first, then at any time in the future, if you want to try an Advantage plan, you can move off of your supplement plan onto an Advantage plan, and then you have that 12-month window to try it out. If at any time in that 12 months you don't want it, you want to switch back to original Medicare and your supplement plan, you can do that without medical underwriting. Outside of the trial rights, if you have a special election period, so the most common is if you're moving outside of your area, there are others, but if you're moving outside of your Advantage plan's coverage area, then you could switch from the Advantage plan to a supplement plan in original Medicare without medical underwriting. Outside of special election periods and your 2 trial rights, if you're wanting to switch from an Advantage plan to a supplement plan, you're looking at medical underwriting, again answering those questions with the potential of being charged higher rates or denied if your health is poor. So you have a higher than normal supplement plan penetration rate, you have a lower than normal Advantage plan penetration rate, and it doesn't add up to 100%. Well, you have a lot of federal employees here, so they're taking federal benefits rather than Advantage and supplement plans. If you qualify for Medicare or Medicaid, then that's kind of outside of this realm here if people are taking original Medicare only or they have some sort of an employer plan. So that's why the numbers don't add up to 100% here. As is the case with all of this, please use an agent to help you with this. Even if it's not us, it will never cost you anything, whether you're looking at an Advantage plan or a supplement plan. Please use an agent. If you do want our help, I do have partners who are licensed and familiar with the plans here in Delaware. My email is in the description of this video, or you can go to theretirementnerds.com. Now, I like to leave a secret keyword at the end of all of these videos to make sure you've watched till the end. If you leave this secret keyword in the comments, then you and I both know that you've made it this far, and I can take those comments a little bit more seriously. Now, from what I understand, and I can be corrected on this, but the University of Delaware's mascot is the blue hen. That is the only college mascot that is inherently a female. So the secret keyword here in the comments would be your favorite college mascot. If you throw anything in the comments related to a college mascot, then I'll know that you've made it at least this far. All right, make sure you subscribe to this channel if you haven't already. It helps more than you know. We're gonna go explore Delaware a little bit more with the family. I appreciate you making it this far, and I will see you in the next video.